Tennessee, grew up in Nashville, and ended up coming back to Chattanooga, and shoulder and sports medicine specialist. Interesting history with Chattanooga. I used to come down here and wrestle when I was in high school, so I've seen the city grow, and we knew it was a great place to end up coming. Med school in Memphis, undergrad at UVA, and trained in Atlanta at Emory University, and then went ahead and did fellowships at Boston, Mass General, and over in Scotland in the United Kingdom. So we got to practice, be a patient and a physician actually in a socialist healthcare system, which was interesting. My oldest son was actually born in Scotland, and we moved back from Edinburgh and came straight to Chattanooga. So in terms of specialty, I'm focusing these days mostly on complex shoulder and sports medicine problems. Really enjoy the arthroscopic treatment of shoulder and knee problems with athletes with ACL injuries, meniscus, and rotator cuff and shoulder instabilities, as well as shoulder replacements and reverse replacements. We see a lot of problems from fractures or from arthritis or from other failed procedures that there's options for nowadays that didn't exist in the past, and so we enjoy being able to offer some help to patients with those types of problems in the shoulder specifically. I've also always enjoyed the technical side of arthroscopic surgery, and I think that's been a revolutionary thing in modern medicine that's allowed us to perform a lot of treatments in a much more minimally invasive way with a lot less downside for the patient, and with that has come a new diagnosis as well. So we're able to find and fix problems that in the past we may not have even found. So orthopedics specifically was appealing to me. I came from a medical background, or family medical background, where my father was a surgeon, and I always knew that I wanted to do something with my hands, and was interested in that aspect of it. And as I progressed through my training, I found with an engineering background, orthopedics was very interesting to me from the mechanical perspective, but also from the perspective that it's one of the few areas in medicine where we can actually solve problems definitively instead of managing problems that essentially slowly get worse with age. We can actually deliver on increased function and pain relief, and the ability to achieve a tangible result was very interesting to me. Probably the most common thing you'll find me doing these days is playing music. It's a good stress relief for me, and I'm playing a lot of piano these days, but grew up playing a lot of guitar and banjo as well, played in a couple of different bands. Haven't had much time for that here recently, but like to do a lot of mountain biking, and we do some martial arts with jiu-jitsu, and we like to cover mixed martial arts events from a ringside doctor perspective. That's always fun. We also occasionally will do some research papers, or even develop some technology, or look into different ways of improving the medical field, and specifically the field of shoulder surgery. Everyone specializes and gets very good and competent at what they are good at, and subspecializes, which is a great way to provide better patient care and excellent outcomes for your patients.